Before I start, I wish to acknowledge the original custodians of the land and the people who cared for and nurtured this land where I am today. Welcome to Genea's on-demand webinar series. Today we'll spend about 20 minutes navigating fertility, what affects it, how we assess it, and treatment options. And then we'll take a closer look at IVF and what happens in the lab. My goal is to give you clarity and practical next steps, whether you're just starting to try or you've hit a few roadblocks. I'm Dr Alice Huang. I'm a fertility specialist and gynaecologist based in Melbourne. I look after people across the full journey, from first questions to more advanced treatments if needed. Here's our roadmap today. First, what infertility means and the role of age and other factors. Then the key test we start with. We'll walk through treatment options, from simple timing support to IVF. And I'll look at IVF in more details and take you inside the lab so you know what actually happens to egg and sperm. We'll finish with what to do next so you feel less overwhelmed and more in control. Let's begin by understanding infertility and the main factors that can get in the way of conception. Clinically, infertility describes difficulty conceiving after a period of regular, unprotected intercourse or difficulty carrying a pregnancy to term. As a guide, if you're over the age of 35, come and chat if it's been 6 months. If you're under the age of 35, come at 12 months. Most pregnancies that do occur naturally happen in the first 6 months. After that, it can still happen, just less often. So it is sensible to check in rather than wait in uncertainty. Age mainly affects egg quantity and egg quality. As we get older, the pool of eggs shrink and the chances of chromosomal abnormalities rises, and time to pregnancy can lengthen and miscarriage risk can increase. It's nothing that you've done wrong, this is just biology. So understanding this can help tailor a sensible plan, not panic. Conception is teamwork between egg, sperm, fallopian tubes, and uterus. Things that can interfere include not ovulating regularly, age-related egg factors, blocked fallopian tubes, uterine or pelvic conditions like polyps or endometriosis, sperm issues, problems with intercourse timing or function, and sometimes everything looks normal and is unexplained. The point is, there are many possible reasons. Our job is to find the most likely ones in your situation. Often, it's not one big problem. It's a few smaller factors adding up. If you don't have any fertility barriers, the expectation is that most couples should conceive in the first few months. If you add one fertility factor in there, it can stretch out. If you add more, the wait can become years. And that's why testing is so valuable. It identifies key friction points so we can choose targeted treatment rather than just hoping against the odds. Lifestyle matters for both partners. Smoking affects hormones and sperm quality and should be avoided when trying for pregnancy or while pregnant. With caffeine, the research isn't perfect, but higher caffeine intake has been linked with longer time to pregnancy and higher miscarriage risks. So a conservative approach while trying is sensible. Ideally, avoid caffeine if you can. But if this is not realistic, aim for 1 cup or less a day for women or 2 cups or less a day for men. With alcohol, it is recommended to avoid alcohol when trying to conceive or during pregnancy because excess consumption can impact both eggs and sperm. Nutrition, weight, and stress management also support reproductive health. So we'll tailor advice that's realistic for you. Next, let's talk about how we check fertility. There's no single test that gives you a fertility score, but we can run a set of simple first-line tests that's put together can give us a clearer picture of your reproductive health. We start with preconception health checks. So making sure the vaccinations are up to date, thyroid function's normal, iron, overall health are all on track. AMH is a blood test and gives us a snapshot of your egg reserve or egg quantity. Now we need to remember that this isn't a pass-fail test, but it does give us context. A pelvic ultrasound can check for ovaries, uterus, and sometimes we can assess the fallopian tubal patency if we need to. On the male side, a semen analysis can look at sperm count, sperm movement, and sperm shape. We can also do genetic carrier screenings for conditions like cystic fibrosis, spinal muscular atrophy, and Fragile X. There are also expanded genetic panels if you want a deeper look. So together, these build a balanced picture so we can plan for the next steps with confidence. Now, treatment pathways, from the simplest support to more advanced options. We match treatments to barriers that we find. So ovulation tracking helps you hit the fertile window. Ovulation induction supports women who don't ovulate predictably. IUI or intrauterine insemination places prepared sperm closer to the egg. So it's useful for mild sperm issues, sexual dysfunctions, unexplained infertility, or when using donor sperm for single women and same-sex couples. Egg freezing preserves options for the future or before medical treatment that can affect fertility, like cancer treatment or endometriosis laparoscopy treatment. IVF is often the most effective treatment when we need to bypass multiple fertility factors. And ICSI, which is ICSI, as an IVF technique where one sperm is injected into the egg, mainly for significant sperm factor issues. Genetic testing with PGT, or pre-implantation genetic testing, can help where there's a known inherited condition or if you have repeated implantation loss or miscarriages. Donor options and, in specific circumstances, surrogacy are also available within legal frameworks. For ovulation tracking at Genea, we do timed blood tests around ovulation and guide you on the best days for intercourse. We confirm ovulation with a progesterone blood test about a week later, and then a pregnancy test at the right time. So this is simple, low stress, and gives peace of mind about timing. If ovulation is your bottleneck, then we can gently stimulate the ovaries with tablets or injections to release an egg more reliably and facilitate timed intercourse around ovulation. It's most effective when irregular ovulation is the only issue, especially in younger women. And we monitor closely to reduce the risk of multiple pregnancies. IUI, or intrauterine insemination, is a bit like giving the sperm a head start. So we first track ovulation, and then on the day of ovulation, we prepare sperm and place it directly into the uterus using a thin catheter. So this reduces the distance for the sperm to travel and can help in mild sperm issues, unexplained infertility, sexual dysfunction, and for single women or same-sex couples using donor sperm. Egg freezing involves 4 parts: preparation, then about 10 to 14 days of stimulation to grow several eggs. Then a short procedure to collect them. And after that, eggs are snap frozen or vitrified and stored for future use. So this is a thoughtful option if you're not ready to conceive now, or you need to protect fertility ahead of certain medical treatments like cancer therapies or laparoscopy for severe endometriosis. In IVF, eggs and sperm meet in the laboratory. With standard IVF, many sperm are placed around each egg. And with ICSI, a single sperm is injected into each mature egg, particularly helpful when sperm numbers or sperm movements are low. After fertilization, embryos generally grow for 5 to 6 days before transfer or freezing. Now we aim to nurture these embryos in stable, undisturbed conditions from fertilization to blastocyst. And this happens in specialized incubators with time-lapse cameras, like the one in the picture. Let's zoom in on an IVF cycle, step by step. Broadly, there are 5 stages. We stimulate the ovaries, we collect eggs and sperm, we fertilize and then nurture the embryo in the laboratory, we transfer the embryo, and then we support the luteal phase and do the pregnancy test. Step 1 is ovulation stimulation. So ovulation stimulation uses daily hormone injections for around 10 to 14 days to recruit a cohort or group of follicles. So follicles are fluid-filled sacs in the ovary that contain eggs. So if we look at the picture on the left, that is an ultrasound picture depicting a natural cycle. So in a natural cycle, usually one follicle matures and releases the egg. And in that picture, you can see a big black circle in the middle of the screen. And that is the developing recruited follicle that's about to ovulate. You can also see 3 other smaller black circles to the upper left of the recruited follicle, and these are antral follicles. So these are other immature eggs in that ovary, which is essentially the reserve in that ovary. Not all antral follicles are destined to develop or release a mature egg. Now we look at the picture on the right of the screen. It's showing an ovary during an IVF stimulation cycle. We use hormone injections to stimulate several follicles to mature at the same time, so we have more than one egg to work with. And you can see these multiple black circles. They're all larger and similar in size. So these are all recruited follicles in that ovary from which we will try to collect eggs that month. By collecting those eggs, we're not using up future eggs. Most of these are follicles that your body would otherwise lose during the month. We monitor progress during IVF with scans like these to time trigger injections, so eggs are ready for collection. Egg collection is a short-stay surgery procedure under light sedation anesthetics. It's guided by ultrasound, and then a very fine needle is inserted through the vagina into the ovaries to draw out the follicular fluid. Then the scientists will find the eggs in the fluid. This takes about 20 minutes to complete, and most people go home the same day. On that same day, we collect sperm as well, usually by ejaculation in a private room. But if we're planning for surgical sperm retrieval or have frozen donor sperm, the lab will be ready. Now, what our embryology team does behind the scenes. The next step is to fertilize the egg with sperm and culture the embryo. So day 0 is what we call the day of egg collection. And that is a picture of an egg under the microscope. As you can see, the egg is surrounded by a cloud of fluffy supportive cells. And that's why we call them cumulus cells, because they look like a cloud. So that cloud helps our scientists spot the eggs quickly and safely. So nature has designed a very good signpost for us to find the eggs. Here you can see stylized videos of 2 insemination methods side by side. On the left is standard IVF. So many sperm around one egg and one gets in on its own. And on the right is ICSI, ICSI. So one carefully selected sperm is injected into the egg. Now we choose the approach based on your result, especially the semen analysis. These are pictures depicting embryo development according to the day after egg collection. So on day 1, a fertilized egg shows 2 little bubbles. That's the pronuclei inside the cell. And one of the pronuclei is from the egg and one of the pronuclei is from the sperm. So this indicates successful fertilization. Day 2, the fertilized cells have started to divide, and it is now a 4-cell cleavage stage embryo. On day 3, the cells continue to divide, and now it has 8 cells. Day 4, the embryo compacts into a morula, and that's when we start to lose the outline of the individual cells as they squish into each other. And by day 5, we see a blastocyst. Now on this blastocyst, you can see a rim of cells on the outside, and that's called the trophectoderm. So that develops into the future placenta. And you can also see a little clump of cells at the 4 o'clock position, and that's called the inner cell mass, which grows to become a baby. This is a picture of the Jerry. It's a dedicated time-lapse incubator that that lets embryos grow in individual chambers without frequent handling. And there are cameras inside that capture the development of the embryo, so the scientists can observe without opening the doors. So this ensures a stable temperature and gas environment, and that's much kinder to our embryos. Genea uses an integrated system, so we use time-lapse incubators with continuous culture media. So that's designed to keep conditions steady from day 1 to day 5. In Genea's internal study, spanning thousands of embryos, this approach was associated with more high-grade embryos than traditional setups. There's no extra cost to the patients for this platform, and it's routinely used for every patient. The key idea is consistent condition to support development. This is one of my favorite parts of IVF treatment at Genea, the Grow by Genea app. It lets you see images and short videos of your embryos as they develop in near real time. So it's a special way to stay connected with what's happening in the lab. Embryonic genetic testing is also another option in IVF, and it can be helpful in some situations, like egg age over 38, repeated miscarriages, several unsuccessful IVF cycles, known chromosomal condition in the family. So testing helps us identify embryos with normal number of chromosomes to transfer. It doesn't guarantee a pregnancy, but it can refine selection and reduces the chance of transferring embryos that can't progress. Embryo transfer is the next step in IVF. It is usually a quick, mostly painless procedure, no anesthetics. A very soft catheter is passed through the cervix and the embryo is placed gently in the uterus under ultrasound guidance. You're in and out quite quickly. After transfer, we support the uterine lining, usually with progesterone. Your pregnancy test is about 10 to 12 days later. That 2-week wait can feel very long, and Genea offers resources like counselor support if you need it. So you're supported by a dedicated team. We have nurses, scientists, counselors, administrative staff, and you also have access to help after hours if something comes up. So you're not doing this alone. A quick word on success rates, how to read them and what they mean. One of the resources available to Australian patients is Your IVF Success website. So this website displays IVF success rates in different IVF clinics in Australia, and there are many ways to look at IVF success. This is measure 1. And so measure 1 is looking at the chances of having a baby from one completed egg retrieval cycle. So that includes all the embryos created from that one egg retrieval, including the fresh transfer and all the frozen embryo transfer. So this measure gives you a big picture view across fresh and frozen transfers. Measure 2 is similar to measure 1, but it does focus on patients having their first retrieval cycle. So it's helpful if you're just starting or want a sense of outcome for first-time cycles. Measure 3 reports the chances of a birth per individual treatment attempt, and most of the time it's a single embryo transfer. So it answers the question, what's the chance of this transfer resulting in a baby? Measure 4 looks at birth per embryo transferred, and it's useful when comparing single embryo transfers. Measure 5 talks about clinical pregnancies per individual attempt. So it's earlier than birth outcomes, but it's still very informative. National data shows success varies with age, with higher rates in younger age groups. But we need to remember your individual chances depends on your results. Age is just one part of that story. Frozen transfers also have good outcomes across many age groups, and the decision between fresh and frozen is personalized. Lab findings, hormone levels, medical history, they all matter. So, when should we seek help? Please reach out if you're under 35 and it's been 12 months. You're over 35 and it's been 6 months. You've been diagnosed with something that could affect fertility, like endometriosis or polycystic ovarian syndrome. You've had recurrent miscarriages. There's a genetic condition in the family. Your GP workup was normal, but you still feel something's off. or simply because you're worried and would like a plan. So, what are your next steps? Genea Fertility Concierge can help you from here. We start with downloading an information pack, then booking a chat with the Genea Fertility GP, organising preconception tests, and then they'll match you with a fertility specialist to map out a plan. Wherever you're starting from, there is a clear next step. Thank you so much for joining me today. I hope this has made a complex topic feel clearer and more manageable. If you like a tailored advice, reach out. We're here to help you plan the path that suits you best.